It is my pleasure to introduce to you Dr. Joy Smith. She is a just a joy, actually. I just got acquainted with her a very short time ago, but I believe that we just clicked. She has a wonderful personality. She's a powerful person, a small person, but with a big, powerful smile. Her energy is amazing, and she has proven to be some type of businesswoman. This is our new Ruby, our pharmacist. Our I mean, she's got so much in her. It's just so hard that when you guys hear her, you'll see what I'm talking about with the energy. I'm just so proud of you, Joy, and so glad to be acquainted with you now and getting to know you and be friendly with you. And I know that you're about to become family because you really are. So, without any further ado, Joy Smith, you're muted, baby.
I guess I should be unmuted, huh?
There you go.
Well, thank you so much, Kathy. I really, really appreciate that. Wakanna is family for me. I mean, they've embraced my baby, embraced my husband. I mean, it's just, if I have to be away from them for any reason, I wouldn't rather it be anything but Wakanna work. So I appreciate you. I am so happy for the things that you do for Wakanna. I really, really appreciate you. Dr. Crawford, Dr. Mitchell, both on the line. Hello, hello. I'm excited to be here tonight, filling in for Dr. Rita because she is handling business at the hospital. But I'm excited to be here because we get to just have an informal discussion about our products. We have so many new people on the line, so many new distributors, new customers, guests. I just think that it's important for everybody to know how to use the products, and then offer the opportunity for any questions. And then if anybody wants to give a testimonial, please drop your name in the chat. And then if we have time towards the middle or around the end, then we'll make sure that we promote you to the panelists so you can give your testimony. But we want to make sure we stay within our hour to respect everybody's time. Okay, so I'm going to start with the tinctures. And panel, if you all need to chime in or want to say anything about these particular products, just let me know. But I'm going to start with the tinctures that Kathy so eloquently explained on our last call and all of our products. So when we're starting with tinctures, our tinctures are here. And they are a proprietary formula of black seed, turmeric, peppermint, and our full spectrum or broad spectrum CBD. Our products are special in that way because you're not going to find this proprietary formula anywhere else. Our tinctures are put under the tongue. You hold for 30 to 60 seconds, and then you swallow so that you make sure that all of the tincture is absorbed. And then you want to make sure that you wait about 15 to 20 minutes before you eat, because you want to make sure, eat or drink, because you want to make sure that all of that tincture is absorbed. You always want to start low and go slow with these products. Make sure, oh, let me see, is there a problem that for some reason you can see in here? Oh, okay. It's in webinar format, correct? Okay. Yeah, it's in webinar format, Shirley, that's why. Okay, so you want to start low and go slow. So we recommend starting with 3 drops in the morning, 3 drops in the evening, and then you work up to find your sweet spot. I love using tinctures and some of our other products for daily maintenance, but I also love using them for daily maintenance, but I also love using them for when I'm dealing with pain. So I'll talk a little bit more about that when some of my other pain trifecta products come up. So there's our tinctures. We have a stronger tincture for those who may be dealing with more severe pain, more severe challenges, and that's our Hempranium MD. Okay, so if you're dealing with more severe issues, you may want to try our Hempranium MD because there is more CBD per drop in those.
Dr. Joy, can you explain to them what CBD actually is?
Oh, I guess we should start there. You know, when we don't have when it's an informal presentation, sometimes it's a little different. So CBD is one of the second most common cannabinoids in the hemp plant, next to THC. And most of you all are familiar with, in the cannabis plant, excuse me, most of you all are familiar with THC because that's one of the prominent ingredients in marijuana. But CBD can be sold, cultivated, and consumed in all 50 states because it contains less than 0.3% of THC. So it does not get you high. It does not cause the paranoia. It does not cause a lot of the other things that THC can cause, but it does have some amazing health benefits, from being an anti-inflammatory to helping with bone growth, to protecting the brain, to helping with seizures, helping with the skin. You know, there's so many different benefits that we're just learning about because now it's and now people can do studies in the United States. There are so many options for CBD. And the reason that CBD can work in our body is the endocannabinoid system. Most of you all don't know what an endocannabinoid system is, or you might because you're a business partner, you learned through our certification. But if you don't know what the endocannabinoid system is, there are receptors in our body almost everywhere, from your brain, your teeth, your liver, your lungs, your kidneys, all of your body that are looking for cannabinoids to bring your body back in balance or bring it into homeostasis. So we're not claiming that CBD is going to cure or treat or diagnose any disease, but what we will say is that it helps with the symptoms that you may be experiencing. If you're dealing with anxiety, if you're dealing with any other health conditions that are causing any symptoms, CBD can be a natural, organic alternative for healing. So that is what CBD is. And I have been using my CBD products since I joined the business. I mean, I love my products. The particular products that I use most faithfully are tinctures, topical, and gummies. And for me, my pain around my monthly cycle gets really, really bad. And so I haven't had to take any ibuprofen, any Tylenol, any of those other anti-inflammatories that are over the counter that can cause problems with your liver, your kidney over time. So I've just been really, really blessed to be able to, use a product that I know is not harming my body, but that's helping me at the same time. Okay, so we did our tinctures already. The gummies, our gummies are amazing. Okay, this is just one form of how we practice our gummies, but it looks like Kathy has some of hers already. You have some of yours too? Yes, ma'am. So our gummies are powerful because they are infused and not coated, right? So our gummies are infused, which is why you want to start with a half and then increase to a whole. You're always looking for your sweet spot. You don't need to take too much CBD at one time. And then if you find that you're not experiencing the desired effects that you're looking for what you're trying to address, then you can move up to a whole gummy. But they are infused and not coated, so don't be fooled. It takes maybe about 30 to 90 minutes to work in your body, depending on the person. So don't just try to load up on the gummies because you feel like you're not feeling anything, because you will at some point, okay? So the gummies are part of my trifecta as well, and I'll tell you how my trifecta works. And we have our topicals. We have several different types of topicals. We have our Dr. Rita's rub, which is our tincture. Well, it's not tincture, but it's our Dr. Rita's rub that is just our liquid formulation that can go onto your areas of discomfort or dis-ease. We have our 500 milligram pain cream, and we also have our 400 milligram pain cream. It's really about trying our topical products and seeing which one works for you. The 500 milligram is going to give you more of that menthol feel. The 400 milligram has some additional essential oils that are really, really good for helping with pain relief. And you can see that Kathy is showing you the kind of consistency and the shea butter base that's in that topical. And then our Power Liquid Relief, or Dr. Rita's rub, is the same consistency as our tincture, but you do need to know that you don't use it like a tincture. You don't put it under the tongue. Kathy's rubbing some on her areas of discomfort. You don't use it under the tongue. This is not to be taken orally. This is only to be used topically. I talked about those 3 items because I wanted to tell you about my personal pain trifecta. When I'm having my pain, I use my topical product on my abdomen. I'll take the pure gummy during the day, and I'll also take the tincture in the morning. Sometimes I have to take it at night as well, but I take my tincture in the morning. And that combination throughout the day makes me not have to use Tylenol or ibuprofen. I don't even know where my Tylenol is. I think that this is just an awesome opportunity to be able to use an alternative to Tylenol, to ibuprofen, to any other pain reliever. And even for some people who are on more serious pain medications, like possibly opioids or things like that, it can give you an opportunity to maybe come down and decrease the dose of some of those medications. So that is an option as well. All right, now we have the products that some people shy away from, but I found great relief from, and it is our inhaled or smokable products. Now, here is our CBD flower that is used in our pre-rolls. We have a vape cartridge, and you can get the vape pen. And you see Kathy is holding up our vape cartridge as well. And the pens we do not provide, but we do have the CBD flower and the pre-rolls that are already made. So these items we have. The pens you have to purchase separately. So in the dry flower pen, we have tons of different videos on how to actually load this pen, but with the dry flower pen, that is not in here. Oh my gosh, where's my pen? But the dry flower pen, you load the flower into it, and it's a safe way to consume your CBD flower. Your pre-roll, this is a 1 gram pre-roll with 100 milligrams of CBD. Please do not smoke this entire thing at one time. You only need 1 to 3 pulls, maybe 1 to 3 times a day. And for me, I like to use the pre-roll when I'm having just, a racing mind. I need to just calm and quiet the noise. This pre-roll has been awesome. Or if I have the pen on me, I will use that as well. Okay. Now, one of the tinctures that I didn't mention is our water soluble. Our water soluble is really, really great for those of us who are not able to hold tincture under our tongues, those of us who are on the go and don't have the time to not eat or not drink 15 minutes after, those with dementia, for instance, that are not going to remember to hold that water soluble under the tongue. I have some in my water right now. But it's just a great way to still get that CBD into your body without having to wait for the absorption to take place. We also have a culinary oil that can go into your brownies or your cookies or things you're baking or cooking with, so long as you don't exceed 350 degrees. Because if you exceed the 350 degrees, it could produce a bitter taste, and you don't want to cook out the health benefit. All right, so those are some of our tinctures and my loves. I'm going to talk about these so that I can lead into our defense products, because those are amazing. My loves are all of our essential oils. I like to call these my little babies. All right, so our essential oils, we have eucalyptus, black seed, tea tree, our essential defense. We have our nasal sprays in both 5 mLs and 15 mLs. We also have our essential defense in 5 ml and our peppermint oil. So essential oils were my first love, and I apologize that I didn't give you my background in the beginning. I'm a pharmacist by trade, but when I started to go on my health journey after my brother got diagnosed with cancer, I just went into the health coaching direction. Then I became an aromatherapist, and then Wakanna found me. So it kind of married all of my skills. But the biggest thing that I love to do is challenge traditional healing methods using plant-based oils. And so Wakanna is able to let me do that, and I love to do it, love to educate. But all of our essential oils were really great because I feel like our co-founders had healing in mind when they decided to pick the essential oils that they did. The eucalyptus, the tea tree, the black seed, the peppermint, all really good for dealing with these airborne microbes that we have, with this COVID virus running rampant, really good at antibacterial and really keeping us above the wellness line. This first defense and essential defense, I really do want to talk about. I know Kathy said that she had some essential defense in her tea, but they have essential oils contained in here that viruses cannot live in the presence of. So particularly cinnamon. That's one of the ones that's in there that viruses just have a really difficult time being around, right? So that's very good in these times. If you're putting it in your tea, on your toothbrush, where else? If you're rubbing it in your hands and inhaling it or putting it in a diffuser, really getting rid of those airborne microbes and microbes that might either be in the oral mucosa or in the nose. When you're using your first defense, you only need one spray in each nostril. And not only do we have essential oils in here, but we also have our full spectrum CBD. It's just amazing to be able to absorb all of that into your body and make sure that you're really staying above the wellness line and keeping your body in balance all at the same time. Before I let Kathy come on, because she is going to tell us about our Royal Defense items that are really, really effective at fighting those germs. I do want to say that our products are power and pure. So the way that you'll know that is by the label color. The label color is black for power and white for pure. Now you may say, what does that mean? Pure means that there's less than 0.0% of THC in that product. So if you have random drug screens at your job, you don't want THC in the products that you're taking, what have you, our pure items, just like our pure gummies, our pure items are the white label. If you don't have any random drug screens at your job and you'd like to take advantage of the full entourage effect, including the THC, you want to try our power products. Our power products have 0.3% of THC or less, and they will not get you high. They will not have you with the paranoia. And yeah, we have certificates of analysis to show that the amount of CBD that we say is in the bottle is in the bottle. There's no mold, no mildew, no pesticides, no heavy metals, nothing that is going to compromise the health of our customers, the health of our business partners, or anyone who chooses to use our product for their health. So Kathy, I'm going to give it to you for the Royal Defense products, and then perhaps we can have some questions and some testimonies.
Be unmuted. So you have your Royal Defense kit there, right?
I do.
Okay, awesome. So guys, during the pandemic, when the pandemic hit, we were full-fledged into our CBD product line. But like Joyce said, we are a company that cares about people. We care about the community. And as she mentioned, when the essential oil line was created, it was created with overall health in mind. And so we had the expertise, we had the scientific connections, and the resources to be able to make a pivot and be able to create a product line outside of CBD that was going to protect everyone. So it also offers an opportunity to add on to other financial opportunities. So, with the Royal Defense line, we created a line of hand sanitizer. You can show that.
The small baby ones and the larger ones.
All right. The hand sanitizer, well, let me just say, all of our products in the Royal Defense line kill 99.9% of all germs that could cause disease. Okay. We can't say that it is COVID killer, but what I can tell you is that our active ingredient, quaternary ammonium, is on the EPA's list of approved COVID killers. So you can go to the EPA's list and you can see that quaternary ammonium is there, okay? And so our entire line is there. We have the hand sanitizer, we have produce wash, which is great because guys, you can't believe how many microbes are on produce. I mean, just think about it. Most of our products, most produce, all produce grows outside, right? Unless it's even if it's in a greenhouse, it is still going to travel to your store or travel to your farmer's market. So that means that the chance of contamination is high. Unless even if you grow it in your own backyard, you still got to watch it, right? You still got to watch it. So produce wash is going to be able to remove anything, pesticides or anything like that that's on that produce. But what's great about what we've been able to create is, guys, I'm going to show you this slide. You just got to see this. You just got to see this one slide that has some information on here that I'm an old microbiologist. I'm a retired microbiologist, and I geek out on numbers like these. But one of the things I was going to show you, the ambulance. There it is. Okay, great. So this is showing our product with an ambulance in Chicago. Okay? So this is a swab. This is showing, and if I can make it bigger, come on, there we go. All right. So what you see here is swab analysis of an ambulance clean prior to swabbing, and then the before and after uses after cleaning. So here's the rear door. And what we're looking at is aerobic plate count. So by aerobic plate count, that just means that you have a petri dish. You guys are familiar with what a petri dish is. And when microbiologists try to figure out how many microbes are on a surface, in an area, in a product, in a food, they can't just count every single teeny weeny cell, right? That would just take way too long. So what they do is they dilute it on a petri dish, and they count colonies. Generally, that dilution, and I'm not going to get too sciencey, but generally that dilution is 1,000 times. So if you see 100, 200, and in this case 3,800, multiply that by 1,000 in the average lab test, right? So if you look at that rear door, you're looking at 3,800 colony formed. Okay. Look after our use after 100. 3,800 to 100. That's amazing, right? Then let's look at the back door. 1,800 to 600. Inside seat before was 600, and then less than 10 colonies after our product. Transport chair. This is the chair that the guy gets in to drive you to the hospital. Had 240 down to 23. And the hand of the person that drives the ambulance has 6,400 down to 160. Now, does the hand sanitizer work, or does the hand sanitizer work? All right. Numbers don't lie. So I wanted to share that with you so that you would see, and from a geek standpoint, from a scientific standpoint, and from, listen, everybody in the world has now gotten way more science than they ever wanted to have because of COVID. We all know way more. Everybody knows if I popped up the COVID, the COVID virus, the look of that, you would know exactly what I was showing you, because everybody's seen what that virus looks like. That's a microscopic view of what the COVID virus looks like. So we've gotten way more science than we ever wanted. But I just wanted to share with you the reason why it's so important to be able to use a product that's going to kill 99.9% of the germs that are out there. And so that hopefully that helps explain why it's important to have something like this. And we're just so proud at Wakanna that we'll be able to create this Royal Defense Line to protect you and your family, your home, clean your home. You got the essential oils. You have the Royal Defense hand and surface sanitizer. You have the Royal Defense produce wash. It even comes in boat, an RV. I mean, there's so much, and you can even get it in a big old gallon like this, okay? So you have the opportunity to be able to share this for schools and churches and other places like that, because everybody wants to be able to go back out into society and be safe, and Royal Defense is a perfect way to be able to do that.
Wonderful. Thank you so much, Kathy. Thank you so, so much. And just like Kathy said, I mean, everybody needs something to protect them from these airborne microbes and these germs that are out here. Everybody needs CBD, but some people, if you're not comfortable or what have you, you always have Royal Defense products that you can lean on. But CBD is for everyone, and I encourage you and implore you to get the education and the information that you need so that you can help us all decrease this stigma that's been against this cannabis plant for so long.
And Dr. Joy, you mentioned the endocannabinoid system, but I just want to emphasize to everybody, and I'm not a doctor like you and Dr. Tice, but I do know enough about science, and I do know enough about being a human. Every single vertebrate has an endocannabinoid system. So even if you don't think that you need CBD, like Dr. Joyce said. You need CBD because cannabinoids help bring our bodies back into balance. And when we're out of balance, that invites dis-ease, that invites infection, that invites inflammation. And so all of those things can be um, put aside when our bodies are taking care of itself. See, CBD doesn't cure, mitigate, or prevent anything, but what it does do, it helps your body do what it was designed to do in the first place.
Yes.
So hopefully that helps.
It sure does. It sure does. I want to take a couple of questions if there are any in the chat. And I do want to emphasize that, Tyus, thank you so much. She was telling us about our tinctures. So our tinctures, our power tincture is, where is it? Right here, 1.67 milligrams per drop. So if you start at that 3 drops in the morning and 3 drops in the evening, you're looking at 5 milligrams in the morning and 5 milligrams in the evening, okay? If you are using our pure tincture, the one with the 0.0% or less, you're looking at 1 milligram per drop. So that's going to be 3 milligrams in the morning, 3 milligrams in the evening. There are suggested doses on the back of our tinctures, but there's also a chart that's based on weight that whoever invited you can share with you so that you can know based on your weight where you should start. Some people have never taken CBD before or don't know how much to take. And that chart can really help you in terms of knowing this is my weight. I have a mild, moderate, or severe condition that I'm trying to address. This is the starting point. And then you can work up from there to figure out what your sweet spot is. Okay, let's see if there's any questions. Is the presentation being recorded? Yes. We don't have the vape pens or the dry herb pens, but Minister Mooney does. So those of you who know Minister Mooney, he is the connect. He is the connect. Cheryl Johns, when I'm using my tincture, I typically use mine in the morning, but if you're dealing with either daily maintenance or trying to address an issue, I would suggest the morning and the evening. You can start with 3 drops in the morning and 3 drops in the evening. Does anyone on our panel have any testimonies, or anybody out in the, couple of people out in the crowd, do they have any testimonies that maybe we can promote them so you can speak about your CBD?
S. Morgan wants to know if you can speak about the flower and the roll-ups, the pre-rolls. Can you talk about those again?
Sure. So our CBD flower contains 385 milligrams of CBD. And so our flower, you can use this to roll up your own joint. These pre-rolls come pre-rolled, hence the name. But you can use the flower to roll up your own joint. And you can also use our pre-rolls if you just are not, if it's not your ministry, it's not mine. So we have our pre-rolls available. But our flower is also good because you can use it to bake and cook with. If you want to infuse your own grapeseed or avocado oil or olive oil, if you want to.
This is a pre-roll.
That's a pre-roll.
So as you can see, you don't smoke the whole thing. I've probably been working on this one for about a week.
Yeah, and I'll open mine so you can see how big it is when it first starts. But with our flour, you can also put it into your oils that you're cooking with. You can put it into things that you're baking. You can cook with it. You can infuse. There it is. That's our flour. You break it down and you can infuse it into some cooking oils. So there's a variety of things you can do with our products, just like you can do it with our culinary oils. And I'm going to open this to show you how big the pre-roll starts. And again, you're not smoking this whole 100 milligram of CBD at one time.
A couple of hits is all. And like I said, I've been working on this for about a week and it's already Wednesday. I think I might have started this on Thanksgiving.
On Thanksgiving, okay, yeah. And it really, 2 puffs and you're like, So it really is a good opportunity to get that CBD into your system. And it's important because our inhaled products get to your bloodstream within 1 to 5 minutes. So if you're looking to address something really quick, a migraine, anxiety, if you're looking to address some type of pain where you're layering our product tinctures, topicals, or gummies, and you want to get that extra relief, that pre-roll or that inhale product is great.
Someone
CBD.
asked about the hair product. So
Oh, the
this is
hair,
this
yes.
is the hemp powered hair. I
Mhm.
love it. It is really, really make sure that your locks are strong and long. I have been having a problem in the top of my head. I guess I could pull it down, but you can't. I don't have a before after, but it really did help me with thinning. For some people, they have thinning edges or thinning area. So what you can do is you want to take it. You can do it two ways. You can take it under the tongue and I would say 3 to 5 drops under the tongue. This is not a product that you have to use every day. So it does have 100 milligrams of CBD in it, but what it does also have is essential oils in there that are specifically cultivated to assist with your hair, like rosemary and baobab and tea tree and what am I thinking of? Peppermint and oh my goodness, it's going out of my mind. Rosemary, yes, and orange oil. Those are cleansers. They're natural hydrants. Well, you know that. I mean, you go ahead and talk about those essential oils, but anyway, they're in there. And so the way that you use this one is you can put the tincture under your tongue, but you can also apply it topically. You never want this tip though to touch the edge of your hair or your scalp because you don't want to contaminate your product, but you just put there and you gently massage that in. Okay, you gently massage it in, and you can also use it in your treatment. So those of us who have locks generally have a water bottle somewhere with some stuff in it to to help keep them moisturized, right? Well, the stuff that I have in mine is hemp powered hair. Okay, and so you can put some of that, I usually put a few dropper fulls in my little water bottle, and I spray it on my hair. Now that I do every day because I just spray my hair every day to keep it moist and to keep it healthy. But if you're treating your hair, and this comes from my Zoom on Monday, so but if you're treating your hair, you want to make sure that it's half dry, and you'll spray it on and then dry it the rest of the time, especially if you're blow drying. And then you can, for me, I don't ever blow dry my hair, it just naturally dries, right? But you just spray it on there and massage it in gently, and it's there. So you got a couple of ways to be able to use that.
That's awesome. And Minister Mooney wants to share his testimony if we can promote him.
Please. Oh my goodness. I might have to pull that slide up and show his picture.
Right.
Let's see. Yeah,
Exactly.
let me see. Just a second, Minister Mooney. I'm trying to find you there. There you are. He should be on panelist by now.
He is. Mr.
Hey, can
Diamond,
y'all hear
how
me?
are you?
Hey, 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 everybody. Well, I have two testimonies actually. First testimony is while we've been in a pandemic, right, and not able to go to the barbershop, I've been putting even more of that hemp powered hair in my beard. And when I tell you my length, can y'all see me pull that out? And the thickness like is amazing. I can't now look at this. You see how that line? It wasn't that high. Y'all can't see that though. But anyway, but that hemp. Now, if you did pull my picture up,
I'm
you
trying to find it. Yep, I found it. I
right.
got it.
So I'm a cancer survivor. So chemotherapy, radiation. Anybody who knows the effect of chemotherapy and radiation is that our hair thins out. It never grows back to being in the original texture. I get a little emotional about that. But what was amazing, yeah, you could actually see it there. You see, and I'm pointing, like y'all can see me pointing, but you see how thin that was up top?
Right
Now,
here.
I actually used to dye my beard, yep, where your air is. I used to dye all of that, and even in the depths of it, yeah, it was just stringy. It was real thin, not thick at all. Now, when you look at June the 12th, oh my God, like you see how the lining is coming up even higher. It was just this hair growth, and the thickness of it is like,
Thick as hell.
yeah, right. Yeah. So, you know, I love the hemp powered hair. I didn't want to put it up here. I wasn't going to do that. I don't want that back. But this, amazing. So, you know, it did, because it works on Doris Mosley taught us that it works on a cellular level, that oil. And that was what I believe made it real thick, you know, work with the follicles that were there. And boom, I got the results. And it's real thick. It's like, that was easy. The top was easy to comb. I just go straight through it. It was just thin. Now I got to wet it to comb it. Anyway, too
Go
much.
ahead.
My other one. So I didn't realize before Wakanna that I actually suffer from anxiety. So it was Senator Pat, that I remember correctly, a little of Phyllis, but mainly Senator Pat, when we went to the radio show. And she was like, man, what's wrong with you? Why you, what? And I said, I'm nervous. It's just something that happens. I'm sweating ferociously. And she was like, I remember she asked me if I tried the vape. And she let me try hers. She put her tip, right, on the pen, on this pen. She put her tip on it. And she was like, you can't smoke in here. Go out to the hallway. So I went into the hallway and took a pull, and Perry Smalls was like, what is wrong with him? I came back in so like calm that I was able to flow without the words, you know, words stumbling and all of that stuff. So I never really realized that even being in ministry and speaking to people and speaking from the pulpit, I never realized that that I was nervous and sweating and words dancing on the page. I thought it was the Holy Spirit, and I do love the Holy Spirit, right? But I really thought, because that was the saying, like, don't rely on your own words, let the Holy Spirit take over. So for years, I was like, man, okay, it's cool, it's my normal, it's my flow. But when I took that vape, no longer dealing with that sweat and anxiety. So I could hear Jesus like, fool, I gave you the words a long time ago, and I gave you the message. That ain't nothing but anxiety. Get out there. But that's my testimony, y'all.
Thank you, Minister Moni. We appreciate you. We appreciate you.
Cool.
Thank you so
Y'all have a
much.
blessed day.
You too.
Robin, you have a testimony too, right?
Yes, I'd just like to share about my experience with the CBD products. This is for the women who are a little bit more mature now. And I noticed a couple of months after my 50th birthday 2 years ago that I started having hot flashes really bad. Like during Thanksgiving dinner, my birthday was in August, and in November, I was having to like strip clothes off during Thanksgiving dinner. You know, I'm breaking out in a sweat. It's summer for me. Everybody else is like cold outside, but you know, and it was just so embarrassing. And it went like that through Christmas parties. You know, I'd have to wear a tank top all the time because I'd be stripping off, you know, clothes, and I didn't want to be down to underclothes. Waking up all night long, like hot, kicking covers off, and then cold and pulling them back on. And this went on for like almost a year. My doctor offered to put me on hormone therapy, but there was she did said it would increase the chance of breast cancer, which, you know, that's a scary thought right there. So I'm figuring, you know, you're just going to have to deal with it. So then one of my friends who was in here, Shannon, she said, you know, CBD can really help with that, you know, and she's a nurse and I am too. And I'm like, I hadn't heard of CBD much, but I did some research on it. And I was like, okay, well, let me try this. And so I started taking it, and it did take a few weeks. I was taking it 3 times a day, or 3 drops. I did move up to 5 twice a day. But after a month, the hot flashes were gone completely. I mean, I was having them several times a day and all night long for almost a year. And last October, I started taking the CBD power tincture and just noticed, you know, it like brought my body back in balance. The hot flashes stopped. The monthlies had stopped. They started back up. So I felt rejuvenated in that way too. But yeah, if you know anybody that's plagued with hot flashes or having trouble sleeping, I take the gummies at night as well. And sometimes during the day, if I'm just feeling anxious, if I have a Zoom presentation or a project, you know, or families tripping out, you know, the vape pens do work very well. I've never smoked any marijuana before, and so I was a little bit hesitant to smoke anything. I don't know much about the flowers or pre-rolls, but the vape pens do work very well. The cartridges, they just put you in a very nice, relaxed place where you can focus better without feeling.
Uh-oh, Robin, did we lose you?
You're frozen, Robin. I'm not sure if you can hear
The
us.
gummies at night and the vape
There you go.
cartridges. That'll really help you out.
Well, thank
Yes,
you
we
for
heard.
Robin. That was amazing. And it just speaks to how CBD can help in such a variety of different issues. I mean, everybody's body is different. Everybody needs CBD for a different purpose, and everybody is bringing their body back in balance for a different purpose.
And I
Robin,
tell
I'll
you,
share. Joy, I'll share a little bit about what really convinced me about CBD.
Please.
As a scientist, I knew about when I learned about the endocannabinoid system and how that worked, I was sold, but I didn't really have a personal testimony. I was really excited about everybody else's testimonies. And so when I
I
started
had
to
to read
really
that.
try CBD, two things. I've got arthritis really bad in my hips. And I was a BC powder person, just BC powder, because it had to be fast, right? BC powder is fast, right? But it tears up your stomach lining, right? And so when I started taking CBD, I noticed that I got more mobility without that churning in my stomach. And that was major. But right before Wakanna came into existence, I had a stroke. I had a TIA stroke, very small. But when you're having a stroke, and if you've had one, it doesn't seem small. It seems like it is the biggest thing in your life. And it was actually the first time I'd ever been in the hospital in my life. I was 54 years old. And that was the first time I'd ever been to a hospital without being a visitor. And so I called Dr. Rita because I knew there was something that I needed to do. I just didn't know what to do and how fast it would work. She mentioned to me that studies show that CBD can assist a person in getting over a stroke. The faster that stroke victims take CBD, because those receptors are in your brain, it can begin that process of pulling back the stroke side effects. So I can tell you that on Friday, 4 day in the morning, I'm country. So 4 day in the morning is about 1 o'clock in the morning. Friday morning, I went to the hospital. Sunday afternoon, I was home. But between Friday and Sunday, I could not lift or walk or stand at all. I couldn't lift my right hand. I couldn't stand on my right leg. I couldn't walk down the hall without assistance. Saturday night, after taking the vape and the tinctures, I was able to walk down the hall without assistance, faster than the nurse, met her back at my house, back at my room, and by 4 o'clock on Sunday, I was home. Now, again, I want to state that we're not saying that CBD will prevent or cure or mitigate. I'm just telling you my story. That's what happened to me. Okay. And so I know now for real because yeah, it did take care of my arthritis. But when you have a scary event like that, and when you feel that tension creeping up your neck, and you know that you're getting ready to have one of those symptoms, the FAST, FAST, when you're getting ready to have one of those and you're calling and they say, yes, come on to the hospital, when you get there and they tell you that, that's the scariest moment. And so, big or small stroke, all I know is when I start to feel a little funky, I'm telling you, um, I came back from the hospital with no medication, no physical therapy, and no physical impairment. So
Awesome.
that do be my story.
That do be. Oh, that is awesome, Kathy. Thank you for sharing your story. I mean, I know so many other people have suffered from strokes or have family members that have suffered from strokes. That is probably very, very helpful for them to hear. Erica Zachary, one of our business partners, wants to give her testimony. I do want to allow our two other medical advisory board members to chime in as we are almost at 9 o'clock and I want to be respectful of everybody's time. So if our two medical advisory board members, if you have anything, and then we can go to Erica. And always, if you have questions, just please put them in the chat.
Yeah, this is Tyus. There's a question in the chat, in the Q and answer about arthritis. And I just want to say that I've used the cream just like Dr. Joy for more menstrual crap issues, but also have used it I got the sample size, the pain relief cream, and that works, within minutes of, you can rub it on your joints. So to answer the question, the cream and the oil can be used for arthritis on your joints and also the muscle too as well.
Thank you, Dr. Tyus. And Dr. Betty, did you have anything that you wanted to add? If not, we're gonna move on to Erica, but I did want to give you the opportunity to speak if you'd like.
Good evening, everyone.
Hi, good evening, Dr. Betty. How are you?
I'm awesome. Thanks for asking. So I just wanted to give my testimony about knee pain, which I have had as a result of an injury some 7 years ago. I'm sorry, I'm not going to show myself tonight. It's a bad hair day. But at any rate, since I've been taking CBD, I have not had any difficulty with my knee, no stiffness, no pain. And I had been taking the Hempranium 500 on a regular basis, 3 drops in the morning, 3 drops in the evening, and a gummy here and there at night for sleep. Even though I don't have a problem sleeping, I just like the fullness, the relaxation of the experience. However, in taking the gummies, I sometimes forgot to take my my evening, especially the evening dose of CBD tincture. And I was doing, and I think I must have, for some reason, not taken it for a good week or so. And I was at the sewing machine, just repairing some things, and I realized that my knee was hurting me so badly that I was trying to determine, well, what, maybe it's the positioning or what have you. And it wasn't. No matter whether I bent my knee, extended it, it was almost excruciating. So in evaluating what the problem was, I realized that I had forgotten to take my routine doses of CBD, and therefore the inflammation from the old injury had kicked up. And so I immediately, actually I did a double dose the first day and put the Dr. Rita's rub on, the liquid relief, and then I topped it off with the extreme relief, which brought me some relief from the discomfort. That night before I went to bed, I did the same thing, and in the morning, I felt so much better. And I got back on my regular routine, and within a day and a half, I would say, the pain was gone and did not come back. So our bodies are full of inflammation. I do try to do a pretty clean diet, but just the stress of life, the echo pollution, et cetera, does contribute to the internal inflammation. And so the CBD actually decreases and many times pretty much eliminates that inflammation, which eliminates the pain. So that is my experience. I have not had that issue again because I remember to take my CBD morning and evening. Hope that helps somebody.
It sure did. Thank you so much. I really appreciate your testimony. I'm gonna let, excuse me, Erica Zachary go ahead and speak. And Erica, you can take it away. Are you out there? Oh, can you promote her, Kathy? I'm sorry. And while
I'm checking for her now.
Okay, and while we're promoting her, Johnny Hall did have a question about the CBD tinctures. Gummies work for everything. No certain milligram of CBD needs to be used for health, pain, anxiety, or insomnia. Johnny, I would encourage you to get back with the person that invited you out, because we have some videos and some documents that we can share with you about the different milligram dosages that you can use for different ailments. Okay, so just get back with the person that invited you and we'll be able to get that information to you.
Erica's on that side. You can unmute yourself, Erica. Oh, you are.
Hi,
Good.
I'm here. Hi, everyone. Thank you. So thank you for allowing me to share. I just wanted to present something because I keep hearing about it. So I'm a person living with multiple sclerosis. I've been dealing with it for about 22 years. And so for anybody that does not know what MS is, it's basically a neurodegenerative condition. So it causes lots of things like muscle spasms and spasticity, like really tightness in your limbs, which my tightness sometimes can be so strong that it causes pain, particularly with weather changes and things like that. Obviously, when you have lots of things going on in your body and you don't never know what the next day is going to look like, because every day is different, it causes a lot of anxiety. It can also cause a lot of fatigue and bladder issues and so forth. So I made a choice 22 years ago not to take traditional medications. I was just uncomfortable with it, with the side effects that I saw people were having from the medications. So I made a choice. And my doctor was working with me to find something that would work for me outside of regular Western meds. And so we started with medical marijuana. And so I wanted to share about that because a lot of times people talk about medical marijuana or they're using marijuana instead. And so I'll say to people, have you tried CBD? And they're like, oh, that doesn't work, or, just lots of negative talk about it. But I try to tell people, think about it, because when I was using medical marijuana, that was great and all. It took away the pain. It took away the anxiety. However, I couldn't do anything else. I was a couch potato. So all I wanted to do was sleep and maybe eat. I didn't want to do anything else. And I'm still employed, thankfully. I'm still employed, so I couldn't even think. I had a lot of brain fog. I couldn't function. I'm a therapist, and so I see clients all day long for the most part. And so it's not helpful if I can't remember what my clients say to me or what I'm supposed to be doing or any of those kinds of things. So I had to transition from that. So I talked to her about that. We tried to find a CBD product that consistently worked for me. And I wasn't able to find one until I found Wakanna. So the products work. And so I'm a product of the product for sure. I start with the MD every day. I use the water soluble. I use gummies at night. And I use the vape when I have pain or pain, mostly when the weather changes, or use the smokable pre-rolls as well. I had to get over that as well because I got a kid here and I was like, I think it was Kathy. So thank you, Kathy. I think this was before I actually knew you. I hadn't seen your face, and you talked to me on the phone one day about just talking to my son about it. He's 18. I think he was 17 at the time. And she was like, well, just explain to him what it does for you and why it's different than because a lot of these kids are just buying things on the street, and why that's not helpful and why you don't want to do that, but how that's different from what I'm doing. And so I thank you. I never got a chance to thank you for sharing that with me, but I do thank you. So I just wanted to share that because I think it's important that people don't mix the two up. Like, it's fine, but I couldn't do that because I still need to work. I still need to function. I still need to drive or do whatever else I need to do in my life. So just wanted to share that.
Thank you, Erica. And that's huge. I mean, Minister Mooney tells us all the time, you don't want to go get the weed from Pookie's book bag. You don't want to go get the, things that haven't been tested, that don't have certificates of analysis behind them, that aren't quality products. So I really appreciate your story and your testimony. And I'm so grateful that Wakanna has been able to help you, from a health and wealth standpoint.
Yep. Thank you.
Awesome. I do see one question in the chat, and we're right here at 8:56, everyone. Thank you for hanging out with us this evening. There was a question about CBD helping with alcohol dependency, and it does help with some of the withdrawal symptoms that can come from alcohol dependency, but also helps to reduce those cravings. So yes, CBD does have that effect. You can do CBD and in your favorite search engine, And whether it's alcohol dependency, whether it's MS, whether it's stroke, whether it's arthritis, there are so many articles and so many things that even the person that invited you can share regarding our videos and all the education that we've garnered around Wakanna and how Wakanna can impact these different diseases. Does anybody else have anything to add on our panel? And if you have any questions, just kind of throw them in the chat so we can kind of address them real quickly, or we can have you email us to get those questions answered.
Dr. Joy, can you speak a little bit more about, just a second, about how it helps to quell urges? I know I have heard from people who do smoke weed, not medical marijuana, they just smoke weed. When they've gotten our CBD products, they have reported to me that it makes them smoke less weed. They don't have a desire for it like they used to. They pull back on it. One of my girlfriends said, "Child, I done saved so much money for, for doing that." But can you talk about how that affects people who smoke cigarettes, Dr. Joy?
So that nicotine gives a, I always forget this terminology, but there's a pleasure sensor in the, Dr. Tyus, do you know the word that I'm looking for? There's a pleasure sensor that's activated when that nicotine gets there, and it stops or it kind of blocks that pleasure response. Or that.
You're not talking about the limbic system.
No, not the limbic system. But basically, with people that smoke or with people who are addicted to alcohol or things like that, the CBD helps to stop that reward, the reward system. So you get that reward, and then you're constantly chasing that extra high, or you're chasing that more nicotine, or you're chasing that extra.
Are you talking about dopamine? No.
No, well,
No.
dopamine is part of that. But the word I was looking for was the reward system. So it stops you from getting that reward and feeling like you have to chase that additional high or that additional drink or that additional nicotine, and really just helps to curb that addiction. It also helps with the symptoms of the withdrawal symptoms. Yes, let's see. Yeah, reward was what I was looking for, but there was another word that my brain is fried right now and I can't even remember. But yeah, CBD is amazing, and it helps with so many different, like we said, diseases, so many different pain, multiple sclerosis, stroke, arthritis, helping with your blood sugar, helping to manage your anxiety, so many different things. So I thank you all, panel, this evening for coming together and sharing your testimony, sharing your stories, sharing your knowledge. I'm sure that people on the line, and as well as people that they will share this with, will really be impacted and really be helped by what we shared this evening. Does anybody have any closing comments before we go?
I'm going to answer Nina's question. She asked if I took the Hemp 500 or Hemp MD after the stroke. At the time, we didn't have the Hemp MD. So what I did have was the 500, and I had the vape. And so I used the regular vape, our 250 milligram vape, and I used our Hemp MD. Now, because I am using it just to maintain, I do take the Hemp MD regularly because my arthritis is kind of severe in my hip. So it really does help. I'm not as severe as certainly someone who has a more serious condition, but it is chronic pain. So I use it for that.
Great, great. Well, we are right here at 9 o'clock. I really appreciate you all hanging out with us tonight. Thank you to our panelists. Thank you to our testimonies. Thank you for you all who had questions. This all helps everyone to learn. We will see you back here next week, and Dr. Rita will be here talking about CBD and how it helps something. She's always going to give us that knowledge and give us that information. So without further ado, you all have a good night, and thank you everyone else. Thank you, panel. Good night, everyone.
Good night.